This training module will review how to complete the Preventing Falls data collection form and terminology used in the Preventing Falls project. After completing this module, you will be able to define a fall event for this project, identify contributing factors to the fall events that occur, and accurately complete the Preventing Falls data collection form for each fall event. So who should be trained as a data collector? Nurse managers, nursing staff, or any other staff that investigate a fall and will enter data into the tool for the units of the project. To make sure that the data is being collected accurately and consistently, data collectors have to make sure they understand the definitions being used for this project of a fall, assisted fall, and intentional fall. The definitions for this project are based on the ND-NQI definitions of a fall and assisted fall. A patient fall is a sudden, unintentional descent with or without injury to the patient that results in the patient coming to rest on the floor, on or against some other surface, for example, a counter, chair, or bed, or on another person. An assisted fall is a fall in which any staff member, whether a nursing service employee or not, assisted the patient by slowing their descent to minimize the impact of the fall. An intentional fall event occurs when patient falls on purpose or falsely claims to have fallen. Patients may fall intentionally or falsely claim to have fallen for various reasons, including seeking attention or obtaining pain medication. When the nursing staff has reason to suspect that a reported fall is an intentional fall event, it should be documented on the data collection form as such. Because intentional fall events are not falls by this definition, suspected intentional fall events are not counted in computing the fall and fall with injury rates. Data collectors have to also make sure they understand the injury level definitions for a fall. The injury level definitions for this project were developed by ND-NQI. The definition for no injury is that the patient had no injuries, no signs or symptoms, resulting from the fall, if an X-ray, CT scan, or other post-fall evaluation results in a finding of no injury. The definition for minor injury is a fall resulting in application of a dressing, ice, cleaning of a wound, limb elevation, topical medication, bruise, or abrasion. The definition for moderate injury is a fall resulting in suturing, application of steri-strips, skin glue, splinting, or muscle joint strain. The definition for major injury is a fall resulting in surgery, casting, traction, required consultation for neurological, basilar skull fracture, small subdural hematoma, or internal injury, rib fracture, small liver laceration, or patients with coagulopathy who receive blood products as a result of the fall. The definition for death is that the patient died as a result of injuries sustained from the fall, not from physiologic events causing the fall. It is important to have consistently accurate completion of the data collection form the staff is using and entering into the Targeted Solutions tool. Please carefully review the following slides on the data element definitions for the data collection form. So let's begin. Was the patient identified as a fall risk? This is based on the fall risk assessment your organization uses. Check Y to indicate that the patient was at risk for falls. Check N to indicate that the patient was not at risk for falls. NA indicates that the patient did not have a fall risk assessment completed. Was the patient discharged prior to the fall? Check Y to indicate that the patient was technically discharged but was still on the unit at the time of the fall. Check N to indicate that the patient had not been discharged prior to the fall occurring. Number of staff required to assist this patient. If known, indicate how many staff were identified as needed to assist the patient up or down from a sitting or lying position. For example, one patient may require 2 nurses to get up. Has the patient fallen previously during this hospital stay? Indicate only if patient fell during this hospital stay. Do not include if the patient fell during a previous hospital stay. Check Y to indicate that the patient has fallen previously during this stay. Check N to indicate that the patient has not fallen previously during this stay. Did the fall result in injury? Check Y to indicate that the patient sustained an injury as a result of this fall, either minor, moderate, major, or death. Check N to indicate that the patient did not sustain an injury as a result of this fall, minor, moderate, major, or death. Note: Please continue to monitor the patient as injuries may not be immediately recognizable and edit the data as needed if you discover at a later time this fall resulted in an injury to the patient. Was a sitter, staff, being utilized at the time of the fall? Check Y to indicate that a sitter staffed by the organization was being utilized. Check N to indicate that a sitter staffed by the organization was not being utilized. Other data element definitions for the data collection form to understand includes patient slid out of bed or chair. This means the patient was in sitting position and fell directly to the floor. Patient was getting into or out of bed. This means the patient was attempting to get into bed and fell, or the patient was attempting to get out of bed and fell. Patient was ambulating or standing. This means the patient was walking and/or in an upright standing position, not seated. To ensure that you are ready to begin collecting fall prevention data, the next few slides will take you through a series of fall scenarios as they relate to the completion of the data collection form. You will then be asked questions pertaining to each scenario to validate your understanding. Once this module has been completed, there will be a brief written test given to assess your understanding of the Prevention Falls data collection form. The goal is to pass the exam with a score of 90% or better. Scenario 1. A patient wanted to call a family member or let them know that she was being discharged. The phone was on the tray located at the foot of the bed. While attempting to reach the phone, the patient fell onto the floor. The RN came in to check on the patient and found her sitting on the floor. How would you complete the data collection form? What location would you choose for this scenario? We know that the patient was in her room when the fall occurred, so on the data collection form you would choose patient room. In the next section, the form asks what was involved in the patient room fall. Given the choice here, we know that the patient was in bed when she fell, so you would choose patient bed. You now skip down to the patient room bed section to the question, how did the fall occur? We also know that the patient was reaching for the phone while in bed, so you would choose patient slid out of bed because the patient was in a sitting position when she made her fall from the bed to the floor. Finally, we know that the patient was reaching for her phone, so you would choose that the patient was reaching for something. If the patient was reaching for something, and this was the reason for the fall, the patient's belongings were not within reach. Belongings should be placed within the patient's range of reach while in a seated position in bed. You do not need to answer the patient was getting into or out of bed questions since we determined the patient slid out of bed. Scenario 2. A patient was walking without assistance from his bed to the bathroom. He tripped over the threshold that separates the room from the bathroom. How would you complete the data collection form? What location would you choose for this scenario? Since the patient was headed to the bathroom for the purposes of this project, the threshold would be considered part of the bathroom, so you would choose bathroom, shower room. We also know the patient was walking to the bathroom, so the correct answer would be patient was ambulating, standing. There is no mention of staff or family around at the time of the fall, so the best answer to the question, was the patient left alone while toileting or showering, would be yes. Scenario 3. The patient is going for a walk alone at 3 p.m., loses balance, and falls in the hallway. The patient received a medication within 2 hours of the fall and was not educated on the side effects and increased risk of falling. The medication was not changed in the past 24 hours. The patient did receive standard education on fall safety, but was not asked about understanding the education. How would you complete the data collection form? What location would you choose for this scenario? The location for this scenario is the hallway. We know that the patient was out for a walk and fell, so the actual location of the fall was the hallway. You will then skip down to the hallway questions on the form and answer the question about how the patient fell. The answer for this scenario would be the patient was ambulating, standing. Next, you would go to the assistance section and answer no to the question on the patient being assisted during the time of the fall. After this, you would go to the education section and answer no to the family member's friend being present since the patient walked alone, and yes to being educated on fall safety, but check unknown because we do not know if the patient had an understanding of it. Next, you would fill out the medication section because the patient was on a medication. You would then answer the following 4 questions related to the medication. You would answer no to the patient being educated on the increased risk of falling, no to the medication being changed within the past 24 hours, no to the administration within 2 hours prior to bedtime, but yes to administration within 2 hours prior to the fall. Since the patient was not going to the bathroom and the call light was not indicated, fill out the form accordingly. Finally, fill out the primary cause of the fall, which in this case was patient lost balance. This now completes the Preventing Falls training module.